like cicadas that emerge every 17 years, or Kansas school districts that like to sue taxpayers for more taxpayer money, Governor Laura Kelly is back at it again, crisscrossing the state and crying to any media outlet that will listen how passing Medicaid expansion in the upcoming session is critical, especially for rural Kansans. But is it? And why is she pushing so hard now? With us now to answer those questions is Roy Lenardson. He is a senior fellow at the Foundation for Government Accountability. Roy, thank you for joining us this evening. Nice to have you on the show, my friend.
Well, it's good to be back. Appreciate it. Thanks for having me.
Always a pleasure to equate Laura Kelly with a cicada.
Well, before we even get started, just think about the premise of this entire thing. What she's saying is, if I put hundreds of thousands of Kansans on welfare, miraculously our economy is going to boom and it's going to be great. I'm not sure what the debate is. I think she had me at a hard no at hundreds of thousands of Kansans on welfare, but be as it may, they have to immediately start using their scare tactics to get people going again. The rural hospital one, by the way, is not just in Kansas. We've heard the same story in Missouri, Arkansas, and so on. And, I'm going to run through some things, but for your listeners tonight, if they go to thefga.org, so THEFGA.org, all of our data is there with sources. Unlike the governor, we actually source what comes out of our mouth. She does not. And so you'll see everything on there, and you'll be able to get a good sense of reality from that. And so, before we get too far asunder here, let's just right out of the gate, expansion states, hospitals close faster than non-expansion states. So it's actually worse. In rural hospitals, more than 50 have closed in expansion states, with more than a dozen of those rural hospitals alone.
Wow.
And all of this is in this report. I would really encourage your viewers, get educated on this, because Medicaid expansion is what's closing hospitals. And look, I know she's not a math major, but let me do the math for your listeners, because they probably do know basic math. Hopefully they were homeschooled. So let me go through it, okay? So Medicaid expansion does not cover the costs when you walk through the door of that hospital.
Right.
So every single patient that walks in the door is a loser for the hospital in terms of what they say it costs. Now, here's the bigger problem. A lot of these folks that will jump on the Medicaid expansion bandwagon can get free or reduced rate private health care right now, or they already have it.
Right, through the marketplace.
That's right. And, your listeners may not know this, but if you're in that expansion population, which is 100 to 150% of poverty, you can right now get a free silver plan through healthcare.gov. No out-of-pocket, nothing. It was a part of one of the CARE Acts that came out of Congress.
Right.
And so if listeners in Kansas need health care, and I get it, I pay for my own health care out of pocket here. I get the reality of it. But if you're in that group that she wants to give welfare to, you can go get a private health care plan. And make no mistake about it, private health care is better than government-run health care.
Yes.
End of story.
And the cost of expansion has far exceeded original estimates. States are on the hook for much more money than they bargained for. I was looking at that report that you mentioned, and again, I agree with you, folks. If they want to see the data, they should go to the FGA.org. But if you look at these numbers, I mean, it's in the states that have expanded, the program covers twice as many people and costs 76% more per enrollee than initially projected. I mean, it literally more people, more cost than what they claimed. And if you
look at your neighbors over in Arkansas, they said they were going to cap out at 215,000 on Medicaid expansion. Right now, there's 343,000, more than double the cost. If you go up into Montana, it's a disaster. They actually implemented a tax on top of it, and it's still not paying for itself. So you can go through all the states. It's the same thing. It's in Idaho right now. It's everywhere. Your neighbors in Missouri just had it through that sham of a referendum process they have over there across the border. And their Medicaid budget now is almost 40% of their budget. You compare that to Kansas, which is 20%.
Right.
Now, I should say, back in 2000, Medicaid, your existing Medicaid program was about 7% of your budget. It's already ballooned to 20%, and that's before the expansion population. Right. Can I just so people understand, we're not talking about Medicare. Medicare is for the elderly. You pay taxes all your life, and that is a health care program that you pay co-pays for and you're entitled to because you pay taxes for that. And that is strictly for the most part, when you're 65 and older. That has nothing to do with this. Medicaid expansion is one group and one group only, and it's able-bodied adults. And what that means is you can get your butt up in the morning and go to work. That's what able-bodied adult means in English.
And pay for your own insurance.
You can get your own insurance or you can work two jobs. But the bottom line is expansion will not cover one more child, one more elderly, one more disabled. Medicaid already does that. And by the way, Kansas is very, very generous, right, who you cover right now. You guys already cover all low-income seniors, anyone with blindness or other disabilities. You cover kids in your state with up to 250% of the federal poverty level, which is pretty significant. Any disabilities with kids, children and former children in foster care. I mean, you cover low-income parents of young children. You're a generous state, and that's where the 20% comes in. So this notion that Kansas doesn't step up to the plate and take care of Kansans is a lie. So I want to get that out. So the expansion population, the secret to all of this is, do you know what the only qualification is to be on the Medicaid expansion population?
No.
You have to commit to remaining poor.
Oh, well, yeah. Okay, yeah. You have to commit to not getting a job.
As long as you're willing to stay poor, whereas, the elderly and children and the blind and all of these easy things to identify where the safety net matters, you literally are ending the safety net and moving it to a hammock.
Right.
And they come first in line, and that's the problem. They're going to go in front of everybody else in your state. You right now have, I think it's upwards of almost 30,000. I could have that number wrong. We can look that up. But of folks on waiting lists, these are people who are entitled to Medicaid services right now, but you don't have enough money for them. Well, just so you know, if you add the expansion people, they move right to the front of the line, all ahead of all of those people. So it's a disaster. And the other thing is, she can't run around the state bragging about the unemployment rate and how great and the jobs that you're bringing here when if you're able-bodied out on Medicaid, you have a better than 50% chance that you will not work. And so can you really afford in Kansas to take 300,000-400,000 people, if you half that, 200,000 out of the workforce? I mean, in Wichita right now, you've got 12,000 open jobs. I looked it up on Indeed.com. Statewide, you've got almost 100,000. It's just a little, I think it's around 95,000 open jobs in your state. You don't need one single additional person on welfare. You need people to get off of. And by the way, the Biden administration has banned and made it illegal to even have a work requirement to get that.
Right. Well, and if you look at the numbers, I mean, the estimates are $6.5 million cost. The actual enrollment cost would probably be more like 16. The numbers in Kansas, it's estimated 170 million or 170,000 enrollees. Again, it'd be more like 330, if not more.
Whatever comes out of her mouth, double it.
Yeah, there you go. And that's about what the numbers look like.
This is not made up. You can go look up online. We have the data now from every state from 2014 on that has expanded Medicaid. Every single one of them was doubled or more in cost and enrollment.
And that's why we can't afford it.
Well, and look, I'd like one state legislator in one of these expansion states just to say, well, you said it was 115,000 people. Well, I'm going to cap it at that, and anybody over that can't get on. But they don't do that. They just go back to the well. There's no accountability. She can be wrong. They can make up numbers because Kansas taxpayers are going to foot the bill. What do they care?
Roy,
federal law, you're going to have to do it.
I appreciate you, my friend. I think the key that I would mention to folks is, this is not an efficient system. There are better ways to do this than trusting a government-run program that is wrought with corruption and wrought with, nearly 30% of enrollee right now has had errors in the current Medicaid system. There's just so many mistakes It's not an efficient system, and I think we could do better. And this is just Laura Kelly trying to deliver on another one of her campaign promises.
Boy, who do you want to be, like Tennessee, Texas, and Florida, or do you want to be like California, New York, or Illinois?
There you go.
Because
yeah.
That's the difference.
Again, if folks are interested, if they want to, they can find you at thefga.org, correct?
Yeah, ORG, and all of our research is organized by topic, and you'll see it under welfare. And all the studies are there. You can download everything. It's right there. You can check our numbers. You can check the sources. And I would challenge the Kelly administration to do the same. Show me the numbers. Show me the sources, because it's not real.
They don't want to have that conversation, trust me. Brother, I appreciate you. Thank you again for joining us, my friend.
You got it. Have a great night.
You too. We'll take a quick break, and then I want to hear from you. You're listening to The John Whitmer Show on 98.7 and 1330 KNSS, Wichita's #1 talk. We'll be back right after this.